Aloha and welcome to EUTF's New Hire presentation. Today I will highlight and go over important information pertaining to your EUTF health benefits. We will learn about what benefits EUTF offers, who is eligible for these benefits, and how to correctly enroll into these outstanding benefits. This presentation is a brief summary and does not constitute a legal document or contract and is subject to change. The agenda goes as follows: who we are, health plan options, premiums and contributions, health plan selection, enrollment form, and last up we will talk about making changes to your enrollment. EUTF and who we are. The EUTF is a state agency administratively attached to the Department of Budget and Finance. The EUTF was established on July 1st of 2003 and provides medical, prescription drug, dental, vision, and life insurance benefits to nearly 200,000 eligible state and county employees, retirees, and their dependents. Our mission: we care for the health and well-being of our beneficiaries by striving to provide quality health benefit plans that are affordable, reliable, and meet their changing needs. We provide informed service that is excellent, courteous, and compassionate. Health plan options. EUTF has many health plan options to accommodate our diverse members. A great way to decide which plan is right for you and your family is to review our Active Employees Reference Guide, which is available online at eutf.hawaii.gov. In it, you will find premiums and contributions, criteria for dependent eligibility, a brief summary of our health plan options and what they cover, and the EC1 enrollment forms. Health plan options. Medical options include the HMSA plans, Kaiser Permanente plans, and the Hawaii Mainland Administrators or HMA plans, which is EUTF's supplemental medical and prescription drug plan. Prescription drug plans include CVS Caremark, which works with your HMSA plans, and the Kaiser Permanente prescription drug plan, which is bundled together with your Kaiser medical plan. Dental coverage is through Hawaii Dental Service or HDS, and vision coverage is offered through Vision Service Plan or VSP. All employees are offered life insurance through Securian Financial. Your employer picks up your premium for the life insurance benefit, so this benefit is offered at no cost to you. HMSA offers 4 different plan options to choose from: the 90-10 PPO plan, 80-20 PPO plan, 75-25 PPO plan, and the HMSA HMO plan. Each plan includes prescription drug coverage through CVS Caremark and chiropractic coverage through the ASH Group Plan Network. 90-10, 80-20, 75-25 usually refers to the co-insurance when you seek services through the provider. PPO stands for Preferred Provider Organization, which means you may go to any doctor or hospital you wish in and out of network. For in-network providers, you will get the most value for your plan and save the most money. Out of network usually will come with higher co-insurance. HMO stands for Health Maintenance Organization and requires you to select a primary care doctor who will coordinate your care and may refer you to other doctors within the health network for specialty care. I encourage you to contact HMSA for more information on plan benefits. Kaiser Permanente offers 2 different plan options: the Kaiser Standard HMO plan and the Kaiser Comprehensive HMO plan. Each plan includes prescription drug coverage through Kaiser Permanente and chiropractic coverage through the ASH Plan Network. Kaiser Health Plan is part of the same organization as their doctors, hospitals, medical offices, pharmacies, and labs. Kaiser Standard is a HMO plan. You will select a primary care doctor to help coordinate your care, but you may visit any doctor that participates within the Kaiser network. Co-payments vary depending on the service you are seeking. Kaiser Comprehensive is exactly how it sounds. It's a more comprehensive plan, and its plan includes more services at no charge or reduced rate compared to the Kaiser standard plan. I encourage you to contact Kaiser for more information on plan benefits. HMA is a supplemental plan and is available only to active EUTF participants who are covered under another non-EUTF primary health plan. Supplemental coverage helps with expenses such as co-insurance or co-payments. You can enroll into the supplemental plan only if you have primary medical plan coverage not provided through the state or county. HMA does not work with Medicare if that is your primary coverage. Premiums and contributions. Another thing to take into account when considering which health plan is right for you and your family is premiums and contributions. This can be found in your Active Employees Reference Guide, online on our website, or on the EC1 enrollment form. A full breakdown is available online at eutf.hawaii.gov. Health plan selection. Here are some things to consider when trying to figure out which health plan is a good fit for you and your family. Employee contributions is how much you will pay towards your health benefit premium. Deductibles is the amount you must pay for a covered service before your plan begins to pay. For example, if you select the Self EUTF HMSA 7525 plan, your deductible is $300 for certain in-network services. For services that your deductible applies to, you must pay the first $300 in eligible charges. Once that $300 deductible is met, the plan benefit begins. The deductible does not always apply to all services. Calendar year and plan year. Some benefits renew on a calendar year, which is January 1st through December 31st, and some benefits renew on a plan year, which is July 1st through June 30th. Calendar year renewals include some medical and prescription drug benefits. Plan year renewals include some dental and vision benefits. In-network versus out-of-network. In-network provider is a healthcare provider your insurance carrier has contracted with to provide services at a negotiated fee. In most cases, participating providers are preferable over non-participating providers because of the lower out-of-pocket cost to the member. Out-of-network provider is a healthcare provider who has not contracted with your insurance carrier to provide services. When you receive services from a non-participating provider, you owe the plan's standard co-payment or co-insurance plus the difference between the non-participating provider's charge and your insurance carrier's eligible charge. Co-payment versus co-insurance. Co-payment is a fixed amount. For example, for a covered service, they may charge a fixed flat rate of $15 per office visit. The amount can vary by plan and type of covered service. Co-insurance is the share of the cost of a covered service calculated as a percent. For example, for most services under the HMSA 7525 medical plan, it'll have a co-insurance of 25%. You would be responsible for 25% and the plan pays the remaining 75%. And finally, there's maximum out-of-pocket, also known as MOOP. This benefit is embedded into all plans, but most people are not familiar with maximum out-of-pocket. So in the next few slides, we will go over this benefit and give a couple examples of how it works. All plans provide you with peace of mind with an annual maximum out-of-pocket. Maximum out-of-pocket, or MOOP, gives you financial protection in case of catastrophic injury or illness. Each of the insurance carriers keeps track of your in-network, out-of-pocket costs throughout the year, and once the MOOP limit is reached, plan benefits will increase to 100% for the remainder of that calendar year. Although our plans function on a fiscal year from July 1st to June 30th, the MOOP is based on a calendar year and will reset every January 1st. We'll go through a few examples to demonstrate the correlation between maximum out-of-pocket, premiums, and out-of-pocket costs. Rick is considering enrolling in either the 90-10, 80-20, or 75-25 self-only plans. The first thing Rick is going to calculate is the annual employee premium contribution amounts, or how much you'll be paying in premiums for the year. Under the HMSA 90-10 plan, he's looking at $4,634. Under the 80-20 plan, it's $2,971. And under the 75-25 plan, it's just $767. Rick is fairly healthy, so Rick anticipates about 4 doctor visits during the calendar year. His doctors charge $100 per visit before insurance pays, a total of $400. Under the HMSA 90-10 plan, there's a 10% co-insurance, which comes out to $40. There is no deductible. The maximum out-of-pocket under the 90-10 plan is $2,000, so it's not met there. His total under this plan is his co-insurance plus the premiums, which is $4,674. Now, let's do the HMSA 80-20 plan. Under this plan, there's a 20% co-insurance, which comes out to $80. There is no deductible. The maximum out-of-pocket under the 80-20 plan is $2,500, so it's not met there. His total under this plan is his co-insurance plus the premiums, which is $3,051. And under the HMSA 75-25 plan, there is a 25% co-insurance, which comes out to $100. There is a $300 deductible under this plan, but it does not apply to in-network doctor visits. The maximum out-of-pocket under the 75-25 plan is $5,000, so it's not met here. His total under this plan is his co-insurance plus the premiums, which is $867. After calculating Rick's annual employee premium contributions and his estimated out-of-pocket costs for the year, if Rick were to enroll into the HMSA 75-25 plan, he would save thousands of dollars compared to the other plans. Let's try another example. Rick is considering enrolling into the same 3 medical plans. So the premiums for these plans will stay the same, except this time Rick anticipates $19,100 in covered in-network medical expenses, with $300 subjected to the 75-25 deductible. Under the 90-10 plan, there's a co-insurance of 10%, or $1,910. There is no deductible, and the maximum out-of-pocket is $2,000, so it's not met here. So his end total will be the co-insurance plus the premiums for that year, which is $6,544. Under the 80/20 plan, there's a coinsurance of 20%, or $3,820. Again, there is no deductible. But this time, his coinsurance exceeded that plan's maximum out-of-pocket, which was $2,500. So his coinsurance hit his plan's safety net. He will not have to pay the full coinsurance of $3,820. Rick needs to change it to his plan's maximum out-of-pocket, which is $2,500. Now let's add back in the premiums for that year, and it equals out to $5,471. Under the 75/25 plan, there is a coinsurance of 25%, or $4,700. Under this plan, there is that $300 deductible that needs to be taken care of first. Now we can add back in the coinsurance. This will actually hit this plan's maximum out-of-pocket right on the head at $5,000. So it's the maximum out-of-pocket plus the premiums for that year, which equals out to $5,767. After calculating Rick's annual employee premium contributions and his estimated out-of-pocket costs for the year, if Rick were to enroll into the 80/20 plan, he would save the most money because the maximum out-of-pocket protected him under this plan. Let's go over a Kaiser example. Malia is considering enrolling in the Kaiser Comprehensive or Kaiser Standard Plan. The first thing Malia is going to look at is her annual employee premium contributions. Under the Kaiser Comprehensive Plan, she's looking at paying $3,225 per year, and under the Kaiser Standard Plan, she's looking at paying $810 per year. Malia will undergo surgery and was told the cost before insurance could be $50,000 at an in-network Kaiser facility this year. Under the comprehensive plan, there is no charge. The maximum out-of-pocket under the plan is $2,000, so it's not met here. Her total under this plan is just the premiums for that year, which is $3,225. Under the standard plan, there is a 15% coinsurance, which comes out to $7,500. However, Malia is only going to be paying $2,500 because of the plan's maximum out-of-pocket under the standard plan. So once Malia reaches that limit, her plan will start paying at 100%. So it's that plan's maximum out-of-pocket $2,500 plus the premiums for that year $810, which equals out to $3,310. In this example, if Malia were to enroll under the Kaiser Comprehensive Plan, she would save $85. Enrollment. No person may be enrolled simultaneously in any benefit plan offered or sponsored by the EUTF as both an employee beneficiary and a dependent beneficiary. For example, you cannot have a standalone self-plan and also have a two-party plan with a spouse who is also a state or county employee. That will constitute as having dual coverage. If you and your spouse or partner are both active employees/retirees, the employer's contribution cannot exceed a family plan contribution in accordance with Chapter 87A Hawaii Revised Statutes. Dependent eligibility. You may add your spouse to the benefit, a domestic partner, or civil union partner. You may also add your children to these plans. Children can be covered until the age of 26 for medical and prescription drug plans. For dental and vision coverage, children are covered until the age of 19 or until 24 if they are unmarried and a full-time student. Children either by birth, a marriage, adoption, and or guardianship are eligible granted they meet the above criteria. In addition, coverage can be continued for an unmarried child regardless of age who is incapable of self-support due to mental or physical disabilities that existed prior to age 19. Employees that wish to enroll into medical benefits or the free life insurance must fill out an EC1 enrollment form. This form is located on our website. To access this form, click on the Active tab at the top of the home page. A drop-down menu will appear, then click and select the EC1 enrollment form. Now, let's go through this form step by step. Employee data. Begin by selecting the event for which you are submitting the enrollment form. Mark the new hire box if you're newly hired, the qualifying event box if you're making changes outside of the open enrollment period, or the open enrollment box during our annual or limited open enrollment period. If submitting the enrollment form for a qualifying event, give a brief description of the event and input the date the qualifying event occurred. The rest of the employee data section is your personal information. Make sure you complete each section thoroughly and print clearly. If you have a spouse or partner, make sure you list their name, social security number, and birth date at the bottom of the employee data section. Coverage and start date. Coverage and start date. Do not skip this section. Carefully consider when you would like your health plan premium deductions to begin and check the appropriate box. You can select one of the following. Option number 1. Coverage starts on the date of hire or event date. Premium contributions start the first day of the pay period in which the date of hire or event date occurs. Option number 2. Coverage and contributions start the first day of the first pay period following the date of hire or event date, first or the 16th of the month. Option number 3. Coverage and contributions start the first day of the second pay period following the date of hire or event date, either the 1st or the 16th of the month. If no selection is made, option number 1 will be used and you will be responsible for the full premium in said pay period. Loss of coverage and acquisition of coverage must start on the event date, which is option number 1. EUTF premium deductions goes according to pay periods. The 1st through the 15th is one pay period and the 16th through the end of that month is the next. Here's an example. Let's say your new hire start date was April 29th. For your benefits to start on that day, you would have to select option number 1 and would have to pay for the full premiums for that pay period. Now, let's say your coverage from your previous job lasts until the end of the month and you don't want to pay for dual coverage. You would select option number 2 because May 1st is the first day of the first pay period following your new hire or event date. Or let's say you want your coverage to start the latest date possible. You can select option number 3. Option number 3 will start on the 16th of May because that's the first day of the second pay period following your new hire or event date. If you are a newly hired employee or enrolling into benefits for the first time, your pay period deduction amounts may be doubled for at least 1 or 2 pay pay periods to accommodate for processing time and payroll lag. If applicable, you will receive a separate notice, the EUTF Health Insurance Premium Deduction Notice, to inform you of additional premiums to be collected and the pay periods that will be adjusted. Contact our accounting department if you receive this notice or you have more questions. Plan selection. In Section 3, select the plans you wish to enroll into. Remember, life insurance is a free benefit. For state employees only, select if you want to enroll into PCP or not. PCP, or Premium Conversion Plan, helps deduct health benefit contributions from your paycheck before taxes are deducted. For more information on this, please contact DHERD, Department of Human Resource Development. For county employees, please contact your departmental personnel officer. Dependent information. Before you get started, on the back of the form, please print your full legal name on the top right-hand corner. In the dependent information section, if you are adding, continuing, or deleting any dependents from your plan, please select the appropriate box. Print the dependent's full name, date of birth, full social security number, relationship to you, gender, and which plans you will be adding, continuing, or deleting them from. If you're adding a dependent for the first time, EUTF would need some proof documents. For example, a marriage certificate or birth certificate within 45 days. Here's a table of proof documents that EUTF will need if you're adding any dependents. The only time we do not need proof documents if you're in a self-only plan. Other insurance information. If you and your dependent are covered under another health plan, you are required to complete this section. The information you provide does not determine how your benefits are coordinated. Coordination of benefit rules are determined by the health benefit plans and follow the guidelines of the National Association of Insurance Commissioners. Employee signature. Again, employees must submit the enrollment form and required proof documents to your Departmental Human Resource or Personnel Office within 45 days, except birth, which was 180 days. All documents must be received in order to process members' enrollment. Once we process your enrollment form, you will receive a confirmation notice in the mail detailing your plan selections and start date. Make sure to review this confirmation notice, and if you come across any errors, use the corrective action form provided within the notice to notify EUTF. If there are no errors, do nothing and keep this notice for your records. Making changes to your health benefits. During the plan year, EUTF will allow you to make certain changes to your benefits depending on the qualifying life event. Common life events include marriage, divorce, death, loss of coverage, and acquisition of coverage. Adding or dropping dependents due to birth, adoption, legal guardianship, foster children, newly eligible, and ineligible students are also qualifying events. If you feel like you experienced a qualifying life event or want more information on qualifying events, head to our website and click the Qualifying Events tab under both the Active Employees and Learning Center pages. If you experience a qualifying life event and wish to make changes to your plans, you must complete an EC1 enrollment form, which may be found on our website at eutf.hawaii.gov. Most of the events need to be reported to personnel within 45 days, except birth, which was 180 days to report. please submit all proof documents along with the EC1 form to your personnel office. Contact the EUTF if proof documents will take longer than 45 days. Open enrollment is your opportunity to make changes to your plans without experiencing a qualifying life event. Open enrollment for active employees occurs once a year. During open enrollment, you may add, remove, or change plans as you see fit. You can also add or remove dependents at that time. New premium rates start July 1st, and the plan year is from July 1st to June 30th. Make sure you're aware of the new rates and when open enrollment is, so you can change your plan accordingly. If you're satisfied with your plans during open enrollment, do nothing, and your plans will continue throughout the new plan year. New hire recap. Review your health plan options, calculate your monthly health plan costs, then download the newest EC1 enrollment form. Complete all sections of the form, attach proof documents if applicable, then submit your enrollment form and proof documents within 45 days of your new hire date to your Human Resource Officer or Personnel Office. Time is typically limited to choose the best health insurance plan for you and your family, but rushing and picking the wrong one can be costly. Here are some tips. Go to your plan year's reference guide and view your plan options side by side. Decide which plan type, HMO, PPO, or supplemental, is best for you and your family. Eliminate plans that exclude your doctor or any local doctors in your provider network. Determine whether you want more health coverage and higher premiums or lower premiums and a higher out-of-pocket cost. Make sure any plan you choose will pay for your regular and necessary care, like prescriptions and specialists. On behalf of everyone from EUTF, be well and be strong.